Hello, everyone. This is Siddharth Dambar from Chicago Arthritis and Regenerative Medicine. Welcome to our weekly live stream. It's been a minute since I last did this. I think specifically it's been about 3 weeks. I've been doing this fairly regularly for the last year, once or twice per week. So 3-week gap or delay feels kind of big. I'm glad to be back on. As probably for a lot of physicians, this time of year gets relatively busy between patients wanting to kind of jump in at the last moment for either evaluations, procedures, or what have you. Throw into it the other stuff going on in the world right now. It's been relatively busy and interesting last few weeks and months. Anyway, I thought an interesting topic to talk about today is something that I see a lot and hear a lot, which is when is really the right time to see a musculoskeletal specialist for your pain. This comes up because I have a recent, I see this all the time, where you see patients where they have an issue and you realize that they've really kind of delayed evaluation and treatment for a long time, and that likely was not ideal for their actual condition, that it led to a more challenging case or even a worse outcome than if they had caught it at an earlier stage. So when is the right time to see a joint or tendon specialist for your pain? Number one, I would say absolutely if you have significant pain. How you define that is, obviously personal as well as very subjective. But I think if you feel like you have significant pain and it's not getting better with just conservative management, then absolutely you should see a specialist for that. Number two would be if you have pain, even if it's relatively mild, that's not resolving. So I think for most of us as humans, we really take a look at pain and feel like we just kind of grin and bear it until it's got really severe. I would say that if you have pain and it's persistent and it's not resolving, even if it's relatively mild, it would be worthwhile having at least a appropriate evaluation to figure out if you have something that requires treatment. Sometimes things that start off very small progressively become much bigger, and that's how most more significant chronic issues develop, meaning that they start in a very small nugget and then sort of snowball into something much larger with time. Number three, I would say pain that's functionally limiting. If you find that there's certain things that you can't do, certain exercises, certain activities at home or at work because of pain, absolutely that's a time when you should get evaluated by a musculoskeletal specialist. In addition, if you have instability, now instability can present in a few different ways. Instability can present as there's looseness or giving away in the joint or tendon that's affected. It can also present as fatigue, meaning if you find that walking leads to one knee feeling more fatigued or weak than the other knee, that could be a sign that you have something significant that should be evaluated. And then lastly, I'd also say if you have chronic swelling. If you have a joint that is chronically swollen, that is a sign that there's some chronic inflammation in the joint. There's a sign of chronic possible instability, and that's something that should be evaluated as well. So next question is who to see. I would suggest seeing a musculoskeletal specialist because like most things in medicine, there's a certain amount of specialization as well as a particular focus and understanding to really kind of get to what's going on. Number two, I would suggest seeing someone who's non-surgical unless you actually have an issue that's surgical. So to me, a surgical issue would be if you have like a fracture, all right? I think everything else you should be checked out by non-surgical specialists first, because a lot of things that are described as more advanced can still be treated conservatively. There's some things that are advanced that just do still need a surgical evaluation, but always go the non-surgical route first, because I think you'd be surprised at what kind of treatment options there are that don't require more risky associated surgeries. So the example that I think of recently where this came up about, hey, should this person have seen somebody earlier rather than waiting so long, is a patient of mine that has ankylosing spondylitis. He's on medications, and he's been on medications for several years, but he had pain that was really ongoing for a while, probably a couple decades. And despite being on the correct medications, he's still having hip and back pains. So why does he still have pain, and what can be done about that? So when I think of someone who still has pain despite having the appropriate treatment, I think of a couple of things. Number one do we have the right cause for his pain? Do we have the right diagnosis? So for example, somebody has knee pain and you think it's coming from their knee, it turns out it's actually coming from their back. Or in this example, this individual that has ankylosing spondylitis, does he also have some other cause for his pain, like wear and tear arthritis, in his case he does. And then again, are there other possible conditions that a person could have? Maybe someone really doesn't have, on occasion I'll see people that have autoimmune issues for causing their pain, or it's been diagnosed as such. And when I evaluate them, I'll actually tell them, look, I don't think you actually have a bad autoimmune issue. I think what you have is more wear and tear, degenerative or instability issue. And then like their correct diagnosis is actually this other diagnosis. And then the other things I think of was the strength of treatment appropriate. So as an example, in this individual's case, I'm talking about with ankylosing spondylitis, he was on some very mild treatments for years, and he should have been on something more aggressive to treat the inflammation. Another example would be someone that has, let's say, moderate level of arthritis in the hip, and they'd receive platelet-rich plasma from someone. That's not really the right treatment. A better treatment would be their own bone marrow-derived stem cells. They just need something stronger than what they've already received. And then lastly is severity of condition. Are you catching a condition, let's say like ankylosing spondylitis, that is relatively burned out, meaning it's just progressive, it's progressed beyond just inflammation where there's a ton of wear and tear arthritis that needs to be treated differently? Or are you catching someone that has really bad hip arthritis that probably needs surgery at that point? A lot of it depends on the severity, the prior strength of treatments, and the cause of pain as well. So to me, getting these things checked out and evaluated by the appropriate sort of physician is a really big key to getting you on the right track for treatment. And if you do so, that's the right way to go. And that's what'll get you a better outcome. Great. Well, I'm glad to be getting back in the saddle with these live streams, and appreciate anyone who's watching and any questions that come from this or any conversations that come from this. As a reminder, we're trying to do this at least once per week, if not twice per week. In addition, today, and this is Thursday, December 17th, I'm doing a live webinar later on in the afternoon on functional medicine, really focused on a functional medicine approach, treating inflammation, gut health, to help improve the pain, fatigue, weight loss issues that my patients with musculoskeletal conditions have and autoimmune conditions have. Great. Well, thank you for your time. Hope everyone does well. Have a good day and live well. Bye-bye.